Hello and welcome. I'm Dr. Richard Facko from Palos Pediatric Dentistry, and you found this video because you're looking for tips or have questions about having a nervous child and how you might approach that with going to the dentist. So hopefully I can add some value and give you some insight based on my experience and how we do things at our practice. But first and foremost, everybody should know being anxious or nervous at the dentist is totally normal. So everybody's child is unique, everybody's kid is special, but at the end of the day, we see a ton of kids who are anxious for a variety of reasons. So the anxiety could be related to fear of the unknown. The anxiety could be related to previous negative experience, or it could just be for no reason. We even have kids who do well for a handful of visits and just kind of have an off day. Maybe it's late in the day and they're woke up on the wrong side of the bed. Take your pick. There's a lot of reasons why somebody might be anxious coming to the dentist, but what I want you to know is that it's all okay and it's all normal. So to me, the biggest thing at our practice is always meeting kids where they're at. So at the end of the day, to me, the long-term value is in building and preserving the relationship between the dental practice, whether that's the dentist, dental assistants, other support staff, all of those people, and our parents and our kids. So it's a business of relationships. At the end of the day, the relationships are the most important part of what we do. So that being said, boy, there's just so many different scenarios where somebody might be anxious. It's hard to cover them all. We can dive a little deeper in some other videos, but today I'll just kind of walk through high level a variety of situations, how those might be handled to hopefully help you feel reassured, feel a little bit better that things are okay and they're going to continue to be okay. So if we start with our youngest kids, babies. So we see kids as young as 12 months old, sometimes younger if somebody has concerns. And those kids will cry. They're not crying because they're in pain. They're not crying because they're being mistreated. They're crying because they're babies. They're doing what they're supposed to do. That being said, we have a handful of very young kids who can actually sit in the chair and make it through a dental visit and be as happy at the end as they were at the beginning. But for most really young kids, it's normal to anticipate they might cry. The procedures that we would do with a crying 1-year-old or 18-month-old or even 2 years old is likely just brushing with a toothbrush, just like you do at home. Doing an exam, just looking with a mirror, and likely painting some fluoride on their teeth. So all pretty routine things. Again, somebody might get upset and cry. It's okay. Sitting in my seat and seeing what we've seen over the years, those experiences actually work to build trust rather than taken as a negative experience. So again, fear of the unknown, they realized they were scared. Maybe they were being forced to do something that they weren't in the mood to do. But when it's all over and they pick out a prize and leave with a smile on their face, they're that much more prepared for 6 months later. They're 6 months older, 6 months more mature, have a positive experience under their belt, and things tend to get better. Older kids can be anxious for a variety of reasons. So again, previous negative experience or just fear of the unknown. When it comes to exams and cleanings with older kids who are really scared, we try to adapt what we do to sort of meet them where they are. So there's plenty of cases where we might not get through every single thing at a cleaning appointment that we normally would. We may not scale and scrape all the plaque off their teeth. We may not even be able to do that good of a cleaning. I have parents get frustrated every now and again. They kind of want us to force that cleaning on their kids, and that just isn't our practice philosophy. Our practice is built on trust and building relationships. And so really the bare minimum for me is I have to be able to see your teeth. So your parent loves you, they brought you to the dentist. We should at least leave here knowing that you don't have significant problems that might lead to quality of life interference in the near future. So at least being able to look so that we can identify problems if they exist is sort of the minimum. And so for really anxious kids, sometimes that's all that we can do, and that's okay. But when we take that patient, slow approach, over time, we find that they learn to trust. We've built that relationship, and things get better, things improve. So lastly, anxious kids who are in need of dental treatment. So our recommendations usually vary a little bit based on the individual. So ranging from proactive treatment where you've got little problems that would be nice to address but don't have to be addressed now. Maybe those are some things that we choose to delay if somebody's really anxious. So depending on the urgency of the problem, sometimes we have the ability to take some time and see where that relationship goes, see if they become less anxious over a couple visits, and hope to see kind of some emotional improvement, ability to tolerate more challenging things. But also we find ourselves in situations where kids have more urgent needs and still don't yet have that emotional capacity to tolerate treatment in the regular setting. So in those instances, we have a variety of options, ranging from some conservative treatment again to help delay, better than doing nothing, but maybe not the full comprehensive treatment. But if it's minimally invasive, that might meet everybody's needs in the short term. Kids who have a little bit more urgent need, we do offer some sedation in the office with board-certified pediatric anesthesiologists. And we're also on staff at Advocate Christ Hospital. So we do take patients to the hospital under general anesthesia, similar process to if they were having their tonsils removed, ear tubes placed, other common childhood surgeries. But in that setting, we would just be caring for their teeth. So again, to me, the most important thing, let's go slow. Let's make calm, calculated decisions. Nobody should feel like, their kid has to be tortured at the dentist because something has to be done today. More often than not, there's ways to plan and delay a little bit. And even if we're just delaying long enough to get that visit in at the hospital or schedule that sedation appointment in our office, we're usually able to buy that amount of time, get somebody feeling better, but most importantly, respect their emotional abilities in the moment, and trying to build kids into young adults and eventually grown adults who are able to proactively seek dental care without anxiety. So I make a living fixing mostly teeth that are going to fall out one day anyway. So I really see my role on this earth, in this world, as preserving quality of life for kids. So treating or preventing pain and infection, but most importantly, doing it in a kind and caring and compassionate way. So I hope that's helpful. Of course, questions, you can leave them in the comments, or reach out to our office anytime. We're always happy to help. But I hope you find the information useful, and we'll talk to you soon.